Scoliosis channel is scientific information and answers for both scoliosis clinician and patients families. We receive lots of questions about scoliosis. What's the nature of scoliosis? What's the best treatment? What's the up-to-date therapy in certain area? So we try to answer all these questions in one channel that's specific, addressing the scoliosis as a most common vertebral column disorders. And we all know that by month of June, which is Scoliosis Awareness Month in the whole world, we now in May 2021, and hopefully in the end of June we will have like series of 20 episodes that handles all these answers and give the answers for all the question for both clinician and patients and patient family, and for public education too. Let's go and start. We have the contents here. We have roughly like 20 episodes for now. It will talk about introduction, history, definition, diagnosis, management protocol, what's up-to-date scientific literature in certain area, exercise, bracing. The patient will find some answers about where is the right path for the best diagnosis and the best prognosis for his case, along with the physician and the orthotist, also the physical therapist. We're going to give all this scoliosis clinician an update about where the research stands as far as bracing, exercise, different way treatment, what's the time frame, what's the specification requirements, all the details, and hopefully we'll answer all the question in your minds. And as you know, if you need any particular specific question, you can always submit it in our email, and we'll be happy and gladly answering you. Scoliosis as a disease or a disorders or a problem on the vertebral column back, it's actually the most common problem in the world. It starts by, here's the spinal cord or the vertebral column, and start to crook, start to bend. We have a side lateral bending in a coronal plane when it reaches more than 10 degrees or more. This is the first hint that, oh, we're gonna get scoliosis now. Let's see the second dimension, which is a lateral sagittal band, anterior posterior bending. Oh, it does exist too. How about the third dimension, which gives the scoliosis the specificity that we call it scoliosis? It has, if it doesn't have the torsion, it's not scoliosis. So the vertebral column or the vertebrae will go either way, clockwise or anti-clockwise. It will rotate. We call this a torsion. So with a torsion and with number 1 and 2, when we reach the torsion here, we give the diagnosis of scoliosis. It's a key component. There's no torsion, there's no scoliosis. I'm talking structural scoliosis, real scoliosis. And we're going to distinguish between this structural, real scoliosis from other pseudo or fake scoliosis. So when we have the 3D disorders, then we add the time and gross to it, because time and gross is very critical, and it gives us a fourth dimension in both diagnosis and treatment and prognosis. When we see the diagram here, we have this, the basic kind of scoliosis, and here we have the straight vertebral back right here. Then we start to get a crooked vertebra here in the thoracic area. We call this thoracic curve, and in this case it's a left thoracic curve. Then we have here, for example, a right lumbar. Actually, as a matter of fact, it's a left lumbar here. So we have thoracic, lumbar. Then we have the long one, the thoracolumbar, which one curve, but it's big. Then we have the double curve, also thoracolumbar, but it's more like S shape. Thoracal going this way, lumbar going this way, so it's S shape. This is mainly the four types of scoliosis curvature: thoracic, lumbar, thoracolumbar, and double curve. So we have the scoliosis, we have the type of curvature. Then we're going to go and take a look at the history. Hippocrates, the father of medicine, was maybe the earliest one that he addresses the spinal curvature, and he treated with traction to the patient, hanging him upside down. We don't do this no more, of course, now, but the traction is a key concept in treatment now in both exercise, specific exercise for scoliosis, and for designing and management and designing and manufacturing for management by bracing. Traction plays a very important role in some new concept of bracing treatment. Then came Galen after him, and he was the first one that used the word scoliosis, which means simply crooked curvature, crooked vertebral column. Vertebral column is not straight, it's crooked. That's scoliosis. Then Ambro Parry, he used the first brace in Mittel in 1590. Alfred Chand, afterwards, he came up with the word idiopathic scoliosis, which will be very significant for us when we put the causes of scoliosis, why it happened, how it happened. We have an idiopathic category. We call it idiopathic scoliosis. It's unknown etiology. We don't know how it happened. We only see the outcome on the spine curvature. It's multifactorial, that nobody knows why it happens. It's all theories, and we're going to discuss in detail. The most important thing, it represents 80% of the cases are idiopathic scoliosis. So that's, if we have 100 patients, 80% of them has idiopathic scoliosis. And no wonder this is the most studied part of scoliosis, the IIS, I mean the idiopathic scoliosis generally. The most literature you will find about it, it's the most common pattern of scoliosis. That's why all the studies and literature and research paper focusing on this particular idiopathic scoliosis IS, and we're going to discuss this in detail in the future episodes. Then came Jack Matthew Delpech. He created the first exercise institute or facility where we invite the patient and we allow him to do specific scoliosis specific exercise indoor for maybe 3 weeks up to 3 months to 6 months, and he addresses the exercise for this particular cases of scoliosis. Louis Albert Sayre, he is the first one that used the plaster cast jacket along with exercise. He combined both of them, and we all was fortunate when William Röntgen invent or discover the X-ray in 1895. X-ray or radiology allow us to see what we couldn't see before. Allow us to see the bone inside the body without actually opening the patient, which was a very big advantage for us to see what we couldn't see before. Then afterward, no wonder Russell Hibbs started his first fusion surgery. When I say fusion, you're going to learn this word more and more and be familiar with it. Spinal cord fusion. First one was 1911, and Paul Harrington, which still his techniques used till now, between single roads and double roads surgery, Harrington roads and nail surgery is still on, and since 1962, but there's new techniques. We're going to discuss all the new surgical techniques that is on right now all over the world, and what's the advantage for each of one, and when we need surgery. Then in 1971 we have the CT scan, the computerized tomography scan, and then we have the magnetic resonance image, the MRI, 1979, and those allow us, and now we have the 3D CT. These allow us to see on the CT, for example, see the actual bone in 3Ds, all the specific composition of bone and bone morphology on 3D, and of course MRI allows us to see all the soft tissue also in 3D in real space and time without actually opening the patient. And I found this a funny thing here, that among 52 ancient Egyptian mummies, when we CT screen all of them, 6 of them had scoliosis. So it's kind of an old disorders that we all need to be aware of. Why scoliosis channel? Because it's the most common disorders, 3% of the whole population. In USA we have 6 million to 9 million, and every single new year we have 100,000 new cases added to the equation. 80% of them, as we said, is idiopathic scoliosis, 20% congenital or acquired, and we mentioned it's 3D orders. 3D, when we add the gross and time, it's 4D, and this is a message or an information through literature and research paper for physiotherapist, medical doctor, doctor of orthopedic, doctor of chiropractic, orthotist, surgeon, both neurosurgeon and also orthosurgeon, for the patient and patient family to decide and to learn and to know what's available in the management throughout the whole world. What's the new schools, what's the old school, what's the advantage of this, what's the disadvantage of this. So it will make their it's like bridge of knowledge for education among scoliosis clinician and patient, will allow the patient to make the best decision for choosing his management plan, and allowing the physician and clinician to address the most recent therapy in the whole world. As again, this channel is for all the scoliosis healthcare provider and for general public education, and it fills gaps among different scoliosis clinicians through the scientific literature and research paper. As I said, month of June is a scoliosis awareness month, and hopefully we are now in May. Hopefully when we reach June there will be few episodes online for everybody that's interested in this subject to learn and to know all the new about new medication, new therapy protocols, more details about the reason for scoliosis, the epidemiology, all the stats, what we do right now, what all other schools in the world, Europe, USA, Africa, among all over the world, what they do for that, and what's the best choices for our patient and their families. My name is Wael Abdullah. I'm a medical doctor and a doctor of chiropractor, and currently I'm obtaining a master's degree on the most recognized scientific scoliosis institute in the world in Italy, and I'll be happy to answer all your questions, and thank you for your attention. And very soon we're gonna launch our second episode on scoliosis channel. Thank you so much, and you have a great day.